Do you feel like you get lost in your emotions? If you've been told by people that you have big emotions or you seem to react emotionally more than what's normal, today I want to talk about emotional dysregulation. Emotional dysregulation is a component to many of the mental illnesses that people struggle with, such as bipolar or maybe borderline personality. However, this emotional dysregulation, which I'm going to refer to as ED, not to be confused with erectile dysfunction. When you struggle with emotional dysregulation, it basically has several components. And although you may see them accompanying a mental illness, they don't always. Sometimes they just happen. And culture can influence that. Let's face it, many people in Italy would be thought to have big emotions. They talk with their hands, they talk a lot. Many times when they talk, spit will come out. They get very engaged with their conversation. They seem to use their verbal skills more. Whereas if you grew up in Japan or one of the Asian countries, you may be more quiet, more polite-minded. Maybe you resist talking or talking loud. So this can be a culture thing. And it's important you know that, because you don't want to cast judgments on someone, especially if you're online dating or Zoom dating or something, whatever that is. You really need to be with them and see how they react. But these are some symptoms that you may have it. And the reason it's important to diagnose it is if you have it, you know something's wrong. And you don't, like, people don't gather to you very much. Like, they may be a little, they seem standoffish or intimidated. They're trying to take in your emotions. If you have emotional dysregulation, you oftentimes are so lost in your emotion that you can't make sense of things. You're confused. And that's why it's important to know if you really have it. So angry outbursts, you can go from being fine to a rage in a matter of seconds, breaking into tears often. This is a very common one, and one that can be mistaken for other things, but it's important that if they have other components besides this one. Freaking out all the time and being called too dramatic, accusing, blaming people of things before you have the facts, breaking things when you're upset, not just feeling sad, but feeling suicidal, feeling abandoned by others all the time, because others may abandon you because they don't know how to deal with your emotions. Um, Lashing out at others before you can stop yourself, feeling abandoned by others, as I said, oftentimes because you did overreact, or people say you overreacted. Feeling misunderstood by those around you. So you feel lonely a lot of times if you have this illness. Your mood swinging rapidly in ways other people find confusing. And this is one of the main problems, is socially this starts affecting you because others don't know what's going on. It's important that we understand that if it's part of a mental illness, you can get it medicated. You can get it medicated anyway, but it's not always advised. And if you have this, you may wonder why, like what caused it. Maybe you don't remember having it at a certain age. You remember developing it at a later age due to something else. Well, these are the things that can cause it. Um, it does things like some people think that it's biological. So there would be some chemical thing that happened to you in utero that you were born with this. You could have had some kind of a birthing trauma, or there could have been a medication that your mother took or something that would have caused it. It could be a result of the way you were parented. Sometimes when parents are avoidant or toxic or abusive, that child will grow up being overly emotional with everything. And the reason is they no longer have a safe boundary of what's appropriate or what's not. Childhood trauma, as well as, any kind of other trauma. For example, Head injuries, like if you have a concussion, many times it can turn into this. When I had my cerebral aneurysm that bursted in 2003, they watched me for this. They warned me about this because whenever you have any kind of assault to the brain, it makes sense that you could also follow with this, with your emotional center not being under your control anymore. What happens to the person who has it, this is what usually brings them to therapy. They have dramatic and exhausting romantic relationships. They're unable to have good friends. They have a low self-esteem. As I told you, they struggle with loneliness. They oftentimes have money problems because they're too emotional at work too, so they can't work, they can't function. If somebody says something to them that catches them off guard, they'll stew and think about it all day. Criminal charges or incarceration, suicidal thinking, or self-harm. Many of the self-cutters that you see or you may be dating, they have this emotional dysregulation. And I'm talking about it once again because it's a component of other possible mental illnesses, but it doesn't get treated as such because many times it's lumped in with the disorder. And that's unfortunate because this is a separate entity, and just talking to the person can really help. Talk therapy, in fact, works for this quite well as long as the person is motivated to go and talk to a therapist. You may be wondering, like, which mental illnesses does it mostly align with? I'm going to go through the most common ones, but once again, I want to caution you that it can exist on its own as well. It can be something medical that you had no, like, let's face it, if I would have gotten this from my cerebral aneurysm, I wouldn't have had any, like, there was nothing that happened to me up to that point. So that would have caused it. The medical cause, I still could have treated with therapy though. It aligns closely with borderline and personality disorders. And I think that if you're aware of that, and this being one small component of that, getting this ED under control may be worth your while because it may be the part that's giving you the most trouble with that emotional or that mental illness classification. Attention deficit hyperactive disorder. Once again, that could have been caused by something that happened in utero, but it's still important that you, if you're aware of this, you take responsibility and get the help you need. Post-traumatic stress syndrome. If you have any kind of, like, let's say you were almost killed, or you saw someone else killed, or something happened to your child when your child was young that was totally just scared you for life. These things can make you overreact, especially in that particular situation, or a situation that is resembling it, smells like it, or the sounds are like it. It tends to go hand in hand with addictive disorders as well. So alcoholics, drug addicts, many times they'll overreact. I know alcoholics, they'll talk about a mean drunk. That's because they can't control. Their emotions are dysregulated, and therefore they get abusive, they get loud, they're mean, they're caustic, and they hurt a lot of people. So other issues that can be connected to ED but aren't necessarily so: bipolar disorder, depression, eating disorders. Many times when you're getting treatment for eating disorders, it's like a whole onslaught of emotional dysregulation, like you're so upset and you just overreact to everything. It's because you're gaining control and finding out what's underneath that starving. And sleep problems. So what do you do if you have this or you're suspicious? I would go to my physical doctor first. I would talk to them. I would have them get me in with a psychologist. A psychologist can actually test you. They can assess you. They can see what you're going through. At that point, let them help you get a psychiatrist so you can get medicated or just continue with therapy. Cognitive behavioral therapy can work with this. So it's not, you don't have to let this problem destroy your life, but you do need to take responsibility and get help.